I didn't really want to start a prescription medication after I got sober from Adderall, but I got to that point where it was benefits versus risk and thinking about it logically, like I need to do something. And I saw the psychiatrist and had a good conversation about what the plan was. Since then, I was on Strattera for a period of time, slowly kind of titrated myself off of both of those things. So I'm not on any prescription medication, but it's a long, thoughtful process trying to navigate that. So I'm not anti psychiatry or anti prescription. I'm anti how we do things in a lot of places. It can be very dangerous. Like the lack of access is a problem, but if we're going to solve that problem by just creating access that's low quality, to argue that that's worse than no access. Like you can cause a lot of harm with people if you're not doing things appropriately.
Somebody get this guy some help!
Or, put more simply,
If you need help like this guy, call your own doctor.
Being on Adderall for several years and then coming off of it, what was the most noticeable change after you go through that withdrawal process? What was the most notable change in the way that your mind and your brain or your kind of internal monologue?
It took a long time, months. So I had eventually gone to an inpatient rehab facility for 8 weeks to get off of Adderall. I left there in September of 2019. And from September until April, I guess I had the expectation of when I left rehab and had been off of Adderall and off of any substances for 8 weeks at that point, that I would start feeling better, start feeling like myself and kind of back to normal. That just didn't happen right away. It took a long time. I had very little energy to do anything, depressed. Because in my mind, I thought, this is probably going to take a couple months to get back to normal. But then it had been 6 months since I had left rehab and I still just felt horrible. And I needed to, again, ask for help at that point. Just had no energy to do anything. It was every day was a struggle. And it was so frustrating because I had gone through years of struggling, finally get sober completely and think like, okay, life is going to get better. It didn't. But I eventually realized that just getting sober from substances doesn't magically make you feel better. I wasn't exercising. I wasn't eating very healthy. I wasn't taking care of myself. So then 7 months later, it was April of 2020. I had gotten so fed up of feeling like crap all the time that I said, I'm going to start counting my calories, start being very conscious of what I'm putting into my body, what I'm eating. I'm going to start exercising every day. And a psychiatrist, addiction psychiatrist, and was started on Wellbutrin. I did all three of those things on the same day. Started Wellbutrin, started exercising every day, and started eating very, very differently. And, not surprisingly, I started to feel a whole lot better. And I kind of tried to stay on that path ever since then. So when people talk about, oh, a couple weeks of being off of the Adderall, you'll be through the thick of it. You'll be through the withdrawal period and you'll start feeling like yourself again. That doesn't happen for everybody. It certainly didn't happen for me, but there's more to it than just stopping a substance. You've got to do the things to take care of yourself too. And it took me a long time to figure that out.
Nicole Lamberson talks about that in terms of how 30-day rehab can be dangerous. She more was talking about benzodiazepines, but I can't emphasize enough that you cannot just treat an addiction like it's some external entity, do it in a controlled environment for 30 days and then come out and, have a new life.
Yeah,
Um,
it doesn't work like that.
Unfortunately, it doesn't work like that. So in terms of long term, it sounds like diet and exercise, but also a prescription medication have each been helpful for you to maintain your health or get you back to what you feel like is a healthy state.
Yeah, I think looking back on it, I mean, it worked out, but like when you make those major changes all at the same time, and then a month or two later, you look back and you're like, I don't know how much of my improvement was based on diet, how much was based on exercise, and how much was the Wellbutrin. Maybe the Wellbutrin wasn't really doing much of anything. I think there's a legitimate possibility that that's what was going on, because I didn't really want to start a prescription medication after I got sober from Adderall. I just didn't really want to, but I got to that point where it was benefits versus risk and thinking about it logically, like I need to do something. And I saw the psychiatrist, and we talked about it together and had a good conversation about what the plan was. Since then, I mean, even afterward, I was on Strattera for a period of time and have since slowly kind of titrated myself off of both of those things. So I'm not on any prescription medication, but it's a long, thoughtful process trying to navigate that, I guess. So I'm not anti psychiatry or anti prescription. I'm kind of anti how we do things in a lot of places. It can be very dangerous. Like the lack of access is a problem, but if we're going to solve that problem by just creating access that's low quality, that's argue that that's worse than no access. Like you can cause a lot of harm with people if you're not doing things appropriately. So yeah, I mean, it's been years now like navigating that and trying to figure out what's best for me.
Maybe it was the external motivator in the Wellbutrin that allowed you to then instigate the diet and exercise changes that are going to be a lot more successful in the long term. I loved what you said there. I get labeled as an anti-psychiatrist all the time. I'm not an anti-psychiatrist. I practice psychiatry.
Right.
I recognize that mental illness exists on a continuum of severity. And, there are certain things that need to be treated for a lifetime. There are some things that need to be treated for a season, and there's some things that need to be treated for a very specific reason.
Yeah.
The nuance is much appreciated in this conversation. What do you think that as a mental health field, and I know that you are now working in more of a rural setting,
Yeah.
providing that care to people who, if they had access to the care, as you mentioned, maybe substandard care, or as I like to call it, a fast food drive-through type of care,
Yeah.
where we're going to see as many people as we can. We are going to essentially sometimes just give them whatever they want because that's the easiest thing to do without having these more difficult, sometimes a little bit confrontational conversations about what risks those meds may come with. What do you see as kind of some of the bigger problems in mental health treatment, or maybe more specifically in the treatment that individuals in rural areas get?
I'll just talk about mainly the job that I wanted to have, and kind of the position that I've somewhat created where I'm working at now is I put myself in a spot where I can take as much time with people as I need. I could have gone and worked elsewhere and right now probably be making a lot more money. But some of those places that I looked at their job postings, and like we're expecting you to see 15 to 20 patients a day fairly early on, and your onboarding process is 4 to 6 weeks. And I don't want to do that. So the place that I started working at, before I started there, they have some psychologists that work there and they did therapy, and they never had a prescriber there. So I'm kind of the first one to do that, to fill that role. And my initial intakes are hour and 15 minutes at least of just meeting with the parents and talking about expectations and giving education, and where I feel like I'm doing things the right way. And then meeting with the kids later and giving them options, as far as there's some kids where vitamins and supplements of certain kinds in certain situations can be helpful and they're worth trialing and going down that route. Or, I'm not opposed to prescribing prescription medications, but I didn't want to be a cog in the wheel of the system that is, let's see as many people as possible and have people, administrators, breathing down my neck about I'm not seeing enough patients. So I think that's probably the biggest problem is we're always in a hurry to get through as many appointments as possible because the people that are in charge usually of the schedule are not the ones that are seeing the patients. And there's a big disconnect there. So I don't know. The only way that I know how to solve that problem is to put myself in a situation where I can take time that's needed with people, give proper education, go through a thorough like risk benefit analysis of certain treatments, and feel like I'm doing the right thing for people.
Yeah, I think we all feel this financial pressure to go and make money. I mean, you have kids, you know, that added pressure, and everything is becoming more expensive also. So there's
Yeah.
this pressure to make money. I just think at the end of the day, I try to remind myself, one, that, okay, I'm making enough money. If this is not enough, then I don't know what level will become enough. But also, I try to remind myself what it was like to be a doctor or a provider 200 years ago. They didn't make very much money. What they had was the respect and the appreciation of their community. It is such an important role, and we are so lucky to be put into that role to help people manage something as complex as their health and their health outcomes. So I love what you said there. I cannot do the 30-minute intake. I cannot do
Yeah.
the 10, 15-minute follow-up appointment. I really don't like doing 20-minute follow-up appointments because life is so much more complex. Not everything is biologic. Not everything is just the result of what we're doing or what we've experienced. It's usually a combination of so many different factors. So it takes time to be
Yeah.
good at it. It takes time. And it also takes patience on both sides. I mean, the pressure that I feel internally to fix or help somebody quickly is almost always superficially elevated compared to the actual expectation, especially
Yeah.
if you set that expectation early with your patients that, hey, treatments that really work generally don't work within a day or two.
Yeah.
These things that really work tend to build in their effectiveness over time, and they tend to get to direct ways of modifying the process that is causing the disease, which unfortunately in psychiatry and mental health, those processes aren't clearly outlined. So, you know, it's great that you are spending time with patients. I think whether it's direct or indirect, providers in general, we don't realize how much influence there is from industry, from financial interests on what we do and how we're told to prescribe and treat people's mental health and medical problems.
Yeah. The way we're trained, at least in my, I think in PA programs, that's the only thing I can speak of from with experience, but we're trained on how to diagnose. Like these are the criteria. This is the DSM-5, and then this is the primary treatment. And you might learn the secondary and tertiary treatments, but outside of that, you're not going to get much more depth as to how to talk to patients, how to do a good job, like what's important. If all we needed was an algorithm of if you check these boxes, this is the drug to give you, anybody can do that. I guess I would argue that's the easiest part of the job is you can give somebody a questionnaire, have them fill it out, give them a diagnosis, and then all you need to know is the first line treatment is X, Y, or Z. It's like how we talk to patients, how we talk to parents, and setting expectations, having them be a part of the decision making process, being collaborative, having them feel comfortable with what we're doing. And I've told people in the very beginning that like I'm not here in charge to tell you what to do or to tell your kid, you know, how to treat your kid. I want this to be a collaborative decision making process. Frankly, because if it's just me and completely in charge of everything, that's a lot of pressure on me, and I don't really want that. And that's the right way to do it. And I've been lucky because for me to start this job and to have a very, very light schedule in the beginning, I've had some assistance with the owners of the practice and kind of navigating this early on in my career. And I've been working still part-time as a pharmacist. That's where my primary income is right now as I ramp up my amount of clients and patients I'm seeing as a PA. So things are working out pretty good. And I think the few patients that I've had so far, I've left feeling very happy and satisfied with how I felt. And I think with how the parents and the kids are feeling about the approach to the treatment plan. And it's a very different feeling than any pharmacist job I've ever had. I mean, I've had days where I left work as a pharmacist and felt okay about some of the things I did, but I'm doing this now more for feeling like I have a purpose in what I'm doing and using a lot of negative experiences of my life to help other people. And like you were saying in the very beginning, it's probably the worst thing that I've ever had to go through, but in the end, it's allowed me to get to where I'm at now. And I need to share my story again because I'm not the only healthcare provider, pharmacist or PA or doctor who struggles with addiction or have been through that. We're out there seeing patients. We're very capable, and I think it can be it's allowed me to be a much better provider. So
Yeah, absolutely. I mean, the flat reality here is that the algorithms and the guidelines that we're following are leading us to become the least healthy developed country in the world. It's not working. What we're doing is not working. There's a classic example of, I think it was University of Toronto, their medical school in the early 2000s was bringing in a consultant of Purdue Pharmaceutical to educate the medical students about the importance of treating chronic pain.
yeah,
Now, we can sit here now and say, well, that's ridiculous. That is happening all over the place in every facet of medical education, and it's happening right under our noses. And again, all that needs to happen from the perspective of financial interests is there just needs to be a debate about it. We just can't have it, everybody agree that this is not working. If people debate about it, then we can continue to, hide under the guise that it might be working.
yeah.
It's so clear to me that it's not working. And looking back on my training, there's just so many flagrant examples. They tell you on first day of medical school, they say, hey, half of what you learn here is going to end up being wrong. But then if you call out the things that are wrong, you can get
labeled
ostracized to a degree or labeled. Yeah,
labeled an anti-psychiatrist, right?
right. Exactly. Dive a little bit deeper into some of the things maybe looking back that you see as problematic within the PA education.
We just have to go through so much information and cover everything in a short period of time. So it's hard to get into a lot of detail into managing depression, anxiety, and ADHD and bipolar disorder, all these things. I mean, by the time I started PA school, I'd been a pharmacist for 10 years and I'd been part of the healthcare system in both hospitals and outpatient pharmacies. They're pretty good grasp on a lot of things, I guess. I don't know how to put that and sound humble about it, but it's just the reality of it. I had some of my classmates who came into PA school who are 20, 21 years old, and they don't have a lot of life experience. So they're not questioning anything we're being taught the same way I didn't really question much when I was going through pharmacy school as a young adult. It was presented that like SSRIs are basically benign drugs that don't cause harm. They're very low risk, potential high reward things. And that's how I was taught. And that's just what I rolled with for a long time. So the similar things in PA school where I saw things differently from my faculty's perspective too, just being a little bit older and having some experience in healthcare. They're doing the best they can. They get kind of an algorithm or a list of topics that they need to cover in our psychiatry class. That's these 35 or 40 different diagnosable conditions. And we need to be able to answer test questions on them and how you diagnose them and then what the treatments are. There's not much time left over to go over any gray area or nuance or like things that are really important in order to do a good job and not cause harm. And that's just the way our system is set up. So I enjoyed my time in PA school, and I think my faculty did the best job that they could, but it's just the way that things are set up. We learn, diagnosis, and then these are the treatments, and then you kind of just go figure it out after that. So it's just scary that you could have some people that come out of like a PA program or an NP program. And I don't want to say this like I'm dogging PAs or NPs. I absolutely am not. But it's just, if a new graduate PA or an NP goes to a workplace that doesn't provide good support, that they're not learning from good mentors, that can be a recipe for harm for patients.
All they know is the algorithm or the guideline that they've been taught. They haven't seen it play out in practice enough to question maybe some of the guidelines that they were taught.
Yeah. But then you look at like, there are problems with access to care. So PAs and NPs help fill that gap. So there's layers to this too, that we need to find a way to provide better care in general. I was at the American Academy of Child and Adolescent Psychiatry conference back in October. I was out in Seattle, and they had a presentation where I think it was a medical director from like Prairie View Health in Minnesota. He was giving a presentation about like the amount of residents coming out of child and adolescent psychiatry fellowships. And they're trying to like ramp up how many people are completing that program and being board certified child adolescent psychiatrists to provide care to patients. They showed the map of the United States, and along the East Coast a little bit, there's an area that was highlighted, and along the West Coast, there's a small area that's highlighted that basically said these areas have a sufficient number of child and adolescent psychiatrists to provide care to patients in those communities. The whole other rest of the map, everywhere in the Midwest, basically 95% plus of the country, there's not enough of them to provide the care for what's needed. How do we fill that gap? And part of their conversation was they have a very specific training program for PAs and NPs that go to their facility that's in Minnesota. There's a tiered program of how you go from new graduate PA or an NP to having more responsibilities, further training, and getting them to the point where they can not only provide access, but provide quality care at the same time. If we're trying to fix that problem, that's what we need to do. Easier said than done, I guess, but there's a lot to that. And I think with me, I'm just trying to be part of that solution. I don't know how I can fix the greater problem, but if I can provide quality care in a rural area of Michigan where we don't have access, that's the most I can do. And then just trying to be an advocate for quality care, I guess.
Yeah, I mean, there are drastically different lengths of training. If I was to go back and do it again, I probably would go to PA school because I would have saved a lot of money, and I still feel like I could have learned just as much by seeking information out, by scouring through original research papers. And, I don't think it matters whether you're an NP, a PA, an MD, a DO. If you cannot think critically about the things that you're doing, and if you cannot take with you into a patient's care the prospect that maybe what I'm doing is wrong, not it is wrong or it isn't wrong, but maybe I need to be open to the idea that it is wrong, or even if somebody has success, that maybe it wasn't what I did that helped them to be successful. If you can't be a skeptical, critical thinker, you're going to end up doing what you're told to do.
Yeah.
I do see, in especially some of these corporate healthcare systems, they will hire the minimum number of physicians and fill as many other roles as they can because it's a cost-saving measure. All of us need to band together and not allow the information that teaches us how to do our jobs be so littered by pharmaceutical industry. It needs to be provided by the actual experts in our field. Would I like more people to listen and watch Renegade Psych? Sure, that would be great. But what I get out of it that's so much more meaningful and impactful is I get to talk to actual experts, not information that is, propagated with an ulterior motive. I get to talk to the experts, and they almost always have more uncertainty than those people who were telling me that what the truth was in my training. They recognize the nuance. They recognize that when we figure something out medically or scientifically, it usually leads to a dozen more questions.
I've listened to a couple of your podcasts where you've had individuals talking about lithium and their treatments with lithium. And even the two people had a different opinion about certain aspects of that. So it's like you have people that have spent years of their life researching this treatment, and they still don't have a consensus on how everything works and how it should work and how to dose it and when to dose it. I think that shows, yeah, exactly what you're saying.
The prime example of that, I had Janusz Rybakowski, who is a Polish psychiatrist, has written several books about lithium, has been a huge advocate for the need to use more lithium and in psychiatric treatment. This is the guy who put out some of the original research that, oh, these bipolar patients taking lithium, they stopped having cold sore outbreaks from the herpes virus. Oh, and then we figure out that lithium directly inhibits that herpes virus from replicating. Well, with that in mind, as somebody who really not starting until medical school, maybe it was the stress of medical school, I started to have a couple of HSV1 cold sore outbreaks a couple of times a year. They're annoying. They are painful. They last for 10, 14 days. So I said, well, I'll just take a supplemental dose, 1/100th of the bipolar dose of lithium. Janusz Rybakowski had no idea that there may be a inhibitory effect even on such a low dose of lithium.
Yeah.
Well, I'm 3.5 years into it, and I've had one cold sore outbreak. None since I upped the supplement just a little bit to, 2 of them a day. So this is a situation where I can't say definitively that the supplement will inhibit the herpes virus ability to replicate. One of the world experts on lithium has said they don't know that that's an effect, and they couldn't reliably say that. But I've had that personally for myself.
Yeah.
That's a piece of evidence that does mean a lot to me, as long as I keep it in its kind of proper place in terms of the quality of that evidence. But yeah, it just speaks to that this person knows more about lithium than 99.99999% of people on this planet. He didn't say that it was a no. He didn't say that it was yes. He said, I don't know. I haven't studied the impact of low doses in
Yeah.
terms of this phenomenon.
And it's respectful to him that he can give that answer and say, I don't know, rather than, you know, otherwise. So a similar thing with that, I had, when I went to that conference, I had been out of PA school for like 2 months and had not even started working as a PA yet. And I go to this conference, and it's probably 98% of like child and adolescent board certified psychiatrists. So I don't even know if I belong here, but I was there to learn, and it was an awesome experience. But one of the things I'll never forget about that is on the first day there, I listened to an expert on like anxiety in children with autism. And he kind of went through how he approaches things and what he thinks works well, and gave a couple examples of what he does. Right. And then the next day, I'm at a different lecture, and they're talking about children that have autism and how to treat their anxiety. Wasn't the same recommendations whatsoever. They're very different. And I'm thinking to myself, like, this is like the mecca of education for child and adolescent psychiatrists. And even the people here don't have a consensus on like how to treat this condition. That was a learning experience, I guess, it might not necessarily be the treatment, the prescription medication that you choose. A lot of it is how you go about doing that is what leads to better outcomes. So yeah, that was interesting. I left there feeling like I was more prepared to work in the job that I'm in now, and learned a lot while I was there. But it was just eye-opening that a couple people that have spent years and years of their life studying this condition, and they don't have a consensus on how to treat it either. So
You'd mentioned something that I deal with a lot, which is imposter syndrome. Just this feeling, this sense, like even with my podcast, it's like, well, why do I think that I can have a podcast and talk about these things? And again, that's the questioning part of my brain that is doing that. And there's a lot of value that I find in doing the podcast. But I have to remind myself that so many of these experts feel something similar. And so many of my patients that are seeking out something that they want to achieve, a goal that they want to reach, some form of school or graduation. So many of us feel like we are imposters and think that it's abnormal to feel that way. I
Yeah.
actually think the opposite. I think it's abnormal. Maybe you have too strong of an ego if you do not have an imposter syndrome.
Right.
I mean, in the field of mental health, like you just pointed out, you go to 10 different psychiatrists with the same patient, you may get 6 or 7 different diagnoses and you may get 10 different treatment plans. How do you manage those feelings of not feeling like I know enough, which at the end of the day, it's really a good thing to have that feeling because it
Yeah.
motivates us to continue to want to receive more information, even if it is uncomfortable at times because it challenges what we thought we knew.
Well, I think I've learned enough over the years that you can't trust everything, even if it's in a certified guideline. But trying to continue to educate myself by reading things, listening to podcasts, trying to seek out quality information. But the imposter syndrome, I definitely felt that leaving PA school. Like, I think a lot of PAs and NPs probably feel this way, maybe me more so than others, but it's like I'm not a child and adolescent board certified psychiatrist. Like, who am I to start working in this practice and being kind of flying solo? Granted, I do have a collaborating physician that I work with and reach out to regularly and ask questions to and whatnot. But there was nights where I was not sleeping well at all because I was just thinking about, I'm not prepared to do this. I'm not ready to do this. And I'll tell myself that I'm not prepared, but if somebody else said to me the things that I've said to myself, I would be very quick to correct them and say, yeah, I am prepared. I've spent many years of my life preparing for this role. I've got a doctorate in pharmacy. I've gone through a high quality PA program throughout its entirety, knowing that I planned on working in psychiatry. So I spent most of my time focused solely on that. I've been through the system. I've been through addiction and come out the other side. I know what it's like to have poor care from a psychiatrist, and I know I'm going to do my best not to do that. So if somebody questioned me about whether I'm prepared to do the job, I would get pretty defensive, pretty angry, and be pretty good at coming up with reasons why I am prepared. But at the same time, I can get in my own head and tell myself that I'm not ready, that I'm not prepared, that I'm not good enough. But finding a healthy, like a lot of things in life, finding a healthy balance between questioning my abilities, questioning myself, and also being confident in myself that I am ready to do this. And I believe that I am, but finding that level of not having too much of an ego, knowing I don't have the answers for everybody, but I'm sure as hell going to do the best I can to provide quality care. So
We find ourselves as humans in these arguments internally. And it's
yeah,
like that ego, that here and now part of us that lives and experiences each moment of our lives and also experiences our minds more automatic, oftentimes can be intrusive or negative commentary. Those parts of what's happening internally for you that you're not trying to create, but then you find yourself, like you just mentioned, arguing with yourself. No, 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 I am good enough. I've got this, I've got this, I've got these other things. My mom says that I'm great and she's proud of me, and et cetera, et cetera. It draws out the importance of recognizing the intention of your mind as opposed to the content that it spills out all the time.
yeah,
So I really think that the intention of us feeling like an imposter is because it's really important for us to continue to educate ourselves on what we do
yeah,
and to recognize I'm not the best at what I do and I will never be the best that I can possibly be. All I can do is move towards that. That
yeah,
is what I can do, because reaching a destination is something that happens in the future. In order to get there, the process involves each moment or each step in that journey. And then once we reach any destination, our mind quickly pivots to the next destination. Um, I'll wrap this up. I think it's from Jim Murphy's book, Inner Excellence. I don't know if you saw the Super Bowl or the playoffs where AJ Brown was reading that book on the sideline.
yeah. Yep.
I had just happened to interview Jim Murphy a year before that about that book. And he, in terms of this conversation, it brings up a passage, and I'll quote it, try to quote it, paraphrase it a little bit. Essentially, he pointed out, if you worship control, you'll always feel like you're out of control. If you worship beauty, you will always be made to. Similarly, in the vein of this conversation, if we worship our intellect, then we're always going to feel stupid. I thought that was so powerful, and it really did emphasize to me that maybe I do have a little bit of worship for being smart, and that might play into that. But all in all, I think trying to figure out what our mind's intentions are with the assumption that they have good intentions can be so helpful in using our negative internal processes or thought processes to help us to figure out what we care about as an individual in this life, what gives our existence meaning and allows us to feel fulfilled on a day-to-day, moment-to-moment basis through our actions.
Part of that imposter syndrome is just because I care, I know how important the job is. And if I didn't feel some level of uncertainty about approaching it, that would be a problem. So
it, I think, naturally leads to a bigger problem societally, to where we lift up people who don't admit that. We
yeah,
lift up people who display this feigned sense of total confidence in everything that they do. Um, that's not what I want to see. That's not who I want to see running these major medical organizations. I want somebody who embraces that uncertainty. But again, it's kind of a black or white, all or nothing type of thinking that I think is a natural part of being a human being, but also can play a very detrimental role in the red versus blue, type of society that we live in. And whether it be that politics or whether it be a myriad of other kind of societal issues, we fall victim to the way that our mind codes information in a black or white way.
yeah,
And then that becomes fused with our conscious belief system because it's all happening in one brain.
yeah,
But if you can parse out that automatic part of our brain and recognize that that part codes like a computer in a ones and zeros type of way, but the conscious you, that frontal lobe or this kind of newer evolutionary brain of yours, appreciates nuance, recognizes you're not a 0%, you're not 100%, you're somewhere in the middle on the vast majority of these kind of scales of who I am and what I stand for and these major kind of societal questions that we run into. Anyway, I'm freaking rambling now. So,
well, I do want to
yeah,
say I appreciate, as part of like trying to further my education and always get better, your podcast has been very helpful with that. A lot of the guests telling their stories, whether they're telling their personal stories as a patient or the providers who are experts on certain things. I think you're doing an excellent job, and I will be a continued listener for sure.
I appreciate that a lot. I can't tell you how motivating and inspirational it is for me for people to send me an email just to state their appreciation. That really keeps me going. I don't know if it should or not, but it's so impactful to hear that what I'm doing is fulfilling the value behind why I'm doing it. So I really do appreciate that. And I appreciate you coming on and telling your story. It's not something that you see this immediate benefit from. And also, our minds love to focus on all the problems and not the
Right.
positive things. If our minds were saying, "Hey, Norman, you did a great job. Appreciate you telling that story," then I probably wouldn't have a job. But again, I know it's not easy to talk about those things, but it's so freaking important so that somebody sitting here listening to this can say, gosh, that sounds very similar. And now I feel like I can go take that next step to seek out what I need in my life because Norman was willing to go out on the limb and tell his story. So again, I mean, part of it maybe sounds fluff, but it is important. And we've got to build each other up and we've got to recognize each other and not just keep each other accountable for the negatives, but be accountable for the positive things that you're doing. So this is absolutely a very positive thing. It takes strength. It takes courage. Your mind's not going to tell you that, so I will.
I thank you. I appreciate that.
Thanks again for watching and or listening. If you're passionate about the subjects that I discuss on the channel, do me a favor and like, comment, subscribe, do whatever you can to make your voice heard, that these are problems that must be addressed in our society. If you have any questions, comments, or concerns, I want to hear them. Feel free to reach out on social media or email us at renegadepsych@gmail.com. And if you'd like to be a guest of the show, or you have a connection to somebody that you think would be a good guest, let us know. Thanks again for listening.
Disclaimer. This podcast is for informational purposes only. The information provided in this podcast and related materials are meant only to educate. This information is not intended as a substitute for professional medical advice. While I am a medical doctor and many of my guests have extensive medical training and experience, nothing stated in this podcast nor materials related to this podcast, including recommended websites, texts, graphics, images, or any other materials, should be treated as a substitute for professional, medical, or psychological advice, diagnosis, or treatment. All listeners should consult with a medical professional, licensed mental health provider, or other healthcare provider if seeking medical advice, diagnosis, or treatment. Or, put more simply,
If you need help like this guy, call your own doctor.
Thanks again for watching and or listening. If you're passionate about the subjects that I discuss on the channel, do me a favor and like, comment, subscribe, do whatever you can to make your voice heard, that these are problems that must be addressed in our society. If you have any questions, comments, or concerns, I want to hear them. Feel free to reach out on social media or email us at renegadepsych@gmail.com. And if you'd like to be a guest of the show, or you have a connection to somebody that you think would be a good guest, let us know. Thanks again for listening.